Hello students and welcome back to the clinical case discussion of thorax. This is the third case that we are attending to. Have a look at this. A 60 years old diabetic has a burning pain followed by grouped vesicles. What are vesicles? Vesicles are small eruptions filled with fluid. Eruptions filled with fluid. So 60 years old diabetic has burning pain followed by a group of vesicles in a band around the chest at the nipple line on the right side. That means there's a group of vesicles are small eruptions which are filled with fluid, and this is coming in the form of a band at the level of the nipple. It may come anywhere in the thorax. It is in the form of a band like this. There's a belief about this. What is this question pointing to? What is your diagnosis? You just try to guess before I tell you this. Okay, so a group of vesicles along the thorax in the form of a band like this. So it comes on the right or it comes on the left, and people have a belief that if this side and this side the band is going to join, the person might die. That's a belief of the patients. So what is this disease known as? Yes, we call it as Nagin in local language. This is what we call as the herpes zoster. This is what we call as the herpes zoster. So diagnosis: herpes zoster. So what is herpes zoster? It's a viral infection. Okay, it's a viral infection, and it is typically along the course of a spinal nerve, So if it can be here also, as the spinal nerve goes through, the vesicles are seen in the area of distribution of spinal nerve. Generally, it is very commonly seen in thorax. Okay, it comes as a band. And there are small vesicles which are filled with fluid. The person gets a very high fever. Okay, and this is what we call as a herpes zoster. Yes, it is curable. Don't worry, it is curable. We have got antiviral medicines, tablets, ointments that we prescribe to the patients, so the patients do become well, but the patients are very scared, and secondly, the fever is very high, the temperature rises. Okay, so in this patient there's a band. The vesicles are along a band. Where is that? At the nipple line. So what is the dermatome at the nipple line? So dermatome at the nipple line, like the dermatome at the level of umbilicus is T10, right? At the level of umbilicus, the dermatome is T10. So what is the dermatome at the level of nipple line? That's T4 dermatome. So this is T4. Okay, that's T4 dermatome. Just remember this. Umbilicus is T10. At the level of nipple, the dermatome is T4. And classically, the vesicles are seen at the level of nipple line. So this is definitely herpes zoster. The moment I look at the patient, I know this vesicles typically along the course of the distribution of the spinal nerve. So that is herpes zoster. Name: what is the anatomical structure where the virus stays latent? So where does the virus remain? Let me just draw this for you. So that's a spinal cord. Okay, that's a spinal cord. So that's a dorsal root. That's a ventral root. That's a spinal nerve. Dorsal root, ventral root, spinal nerve. Clear? What is this? Yes, what is this structure? That's a dorsal root ganglion. And the virus remains latent in this dorsal root ganglion. Remember, students, this dorsal root ganglion is derived from neural crest cells. Yes, and the virus remains latent in this dorsal root ganglion. So the answer for this third question is dorsal root ganglion. Fine. And coming to the last question, name one key sensory territory area of intercostal nerve that explains the band distribution. So why is that band distribution? You're understanding? It's in the form of a band like this. It can be anywhere. It can be on the upper limb. It can be on the lower limb. It can be in the thorax. So what does this band indicate? The band indicates the course of the spinal nerve. So these vesicles typically come or typically are formed along the course of the spinal nerves. So key sensory territory area is the distribution of the intercostal nerves. So that describes the band pattern. So clear, students? Clear? This question is clear to all of you. So herpes zoster is a viral infection along the distribution of the spinal nerve. Typical vesicles are seen which are filled with fluid. There's a very high temperature. It's very painful. It's very painful. That's why the patient comes to us. So the moment we look at this condition, we know it is herpes zoster, right? So it can be coming anywhere in the thorax. And I told you the belief that the people have about this viral infection, right? So dermatome, this is an MCQ, students. Dermatome at the level of nipple line is most commonly. Yes, answer this MCQ in the comment box. We have just seen this while discussing the MCQ. We discuss important topics about the MCQ in and around the MCQ. So you get an overall orientation of the topic, right? Plus an MCQ at the end, which will help you to boost your confidence if you have listened to the explanation properly. Fine, students, I hope you are enjoying this series of clinical case discussion of the thorax. Okay, thank you so much.